today, Friends of Buzzy. It is almost May. What an exciting and interesting April it has been. Well, today we're going to talk about COVID updates, new things. I'm in Georgia, so it's a little bit different on the streets now, but not that much if you're not going by tattoo parlors or bowling alleys. But I did see that the nail shop was open when I drove by the bank, and couldn't see that there was anybody in it though. But we'll talk a little bit today about COVID, and we're going to talk about pain, fear, and focus, and things to do to address issues when you're staying at home and you have pain and you can't get out to do the things you normally do, or you're waiting for surgery and you can't mitigate pain in that way. All right, but let's start out, and as always, if you want to ask me any COVID questions, just do it, and I will either answer them now if I know the answer off the top of my head, or I will do it later. So this has been a really interesting weekend for me, thinking about things related to coronavirus. In reverse order, so I just got back from the bank because I had to notarize something for taxes, and one of the tellers who I have known for a decade said, "All right, Dr. Baxter, shoot me straight because I know you're a medical doctor. Is this thing real?" And I was astounded because she has a friend who lives up in New York who said, "I'm driving by the hospitals, they're empty, or there's no cars outside." She didn't say they were empty, but said there's no cars outside, and apparently there was some hot mic that caught people at the news briefing that said, they said they were vaccinated and that there wasn't any such thing, or the death rate was 0.000 something. So first of all, I would not think it needs to be stated, but this is a real thing. Now, I will say that the death rates in a lot of states are 4 per 100,000, which is crazy fractionally low, and it's lower than normal flu. However, the death rate overall for places that have had time for it to spread is probably going to end up being about 0.5, which means that 2 people out of every 100 will die. So, you know, it's, or 1 person out of every 200. There you go. Reverse the math. So, and that's about 10 times more than with regular flu. So it could be higher than that, but certainly that's overall. Now, the thing is, the people who are at risk are really, really different from your general flu. And there's a paper that just got published the 24th of April on MedRx, and this is a website. It publishes, it's a repository of papers that have been submitted but not yet peer-reviewed. So this means that they could still have issues in them, like, for example, the hydroxychloroquine study that was published up on this but hadn't been peer-reviewed, and they had excluded a whole bunch of cases that they shouldn't have that made it look safer than it was. So you do have to be able to read science and interpret science to use these things properly, but there was a huge correlation study done from Mexico that looked at different risk factors and put them in relation to each other. And so we'll talk about that in a second, but that's going to be hugely important as we open up parts of the country. Because the thing is, if you're under the age of 40, looking at their model, that was like a -7 on the risk factor. I mean, being under 40 is so hugely protective. So we'll talk about that, but I think that because this is different from a lot of other infections we've had to deal with, we're still getting our head around how not to have a scene like New York where people are dying all over. And so let's address that. I have a friend who went to medical school with me, Dr. Shirazi, and she is a surgeon. She joined the Navy to serve her country and figured that she would be going to Iraq or Afghanistan. Instead, she is at Elmhurst, and she's up in New York, and I had been feeling guilty about not going up there, and she said, "Oh my God, Amy, it is awful. It's so much worse than what you see on TV." She said, "You go into a shift and there are dead people in chairs." The thing is that this virus causes you to be able to breathe but not get oxygen in, so people don't feel like they're short of breath, they're working hard, but they don't feel as short of breath as they are. And in reality, their oxygen saturations are 70 or 60, and then they just crash, and their respiratory arrests 2 or 3 times an hour. So it's super real, and it's super scary. But there are things that are different about Japan, they're different about New York, they're different about Thailand, they're different about different places that mean that we may be overly careful in some places where we don't need to be. There was a study that came out from Santa Clara that put the estimate of people that have already had the virus and not been severely impacted at something like 30% of the population. Now, the thing is, they've already been criticized enormously, and they've dropped that back down to saying maybe 8% of the population has been exposed, because they went on Facebook and said, would you like a coronavirus test? And so who is more likely to want a coronavirus test than someone that has already been sick and went, I wonder if that was corona. And so they have a bias sample. But the doctor who did the study has come out with this article on the Hill saying, look, we should just protect the people that are at risk, and everybody else can go about their business. I think that would be right, except for 3 things. The first thing is that we are still finding out who is at risk, and that will relate to this study from Mexico I'll talk about. And until we have a really good idea of who is at risk, people won't know how to protect themselves, let alone have society protect them. Second thing is that when we say, let's protect those who are at risk or isolate people who are at risk, the only way that works is if you're at risk and you have to have a job, then our government needs to pay for you to have a salary. We need to provide people to come and bring food to people that have to stay at home. We need to protect people financially as well as physically, and I don't see us being good at doing that. Third thing is that by just saying, okay, let's go out there and open up society and have people protect themselves, knowing that they may not, the people who pay the price of that are healthcare workers. And all of this stuff about giving flybys or ticker tape parades, I've talked to a lot of doctors, and all of us to a person don't feel like we're heroes. We don't feel like we save a life in isolation. I mean, you're part of a team. When you're in the emergency room and people don't die, everyone's like, oh my God, you saved their life. And you're like, well, maybe if they were out in a field by themselves, they would have died. But that doesn't mean we feel like we get credit for saving a life. We don't feel like heroes, but we can feel taken advantage of. So if as a society we expose ourselves to a tremendous amount of risk, figuring that the people, the nurses, the doctors who are having to deal with dead people in chairs, that may last for a little while, but over the summer, if we're not taking care of our doctors, then a lot of these nurses and doctors, it takes 12 years to train to be an intensive care doctor. It takes decades to get really good at understanding how to quickly take care of somebody who may die in minutes. You don't just get that skill overnight. And a lot of people who have the skills to be able to take care of the sickest also, by definition, have the skills to be able to take care of the not so sick. So if you're an emergency doctor, you can't just make a community pediatric office tomorrow. So if you're a pediatric emergency doctor. So we can't just let everybody start going out without making sure that we have enough PPE for everybody to have one for each patient, because it's what we're used to and we don't feel taken care of if we don't get that. We cannot have salaries cut for doctors who are dermatologists, who are internal medicine doctors who don't see patients right now, because we talk to each other and we all feel this bond being in the medical field because the training is so brutal and the calling is so strong. And so we can't cut salaries for people who are not seeing patients right now without all of us feeling offended and upset. Likewise, hazard pay. I think everybody who's a doctor would be fine with residents getting hazard pay, and not doing that is an insult. So we got to fix those things before we can just let everybody go. Now, so getting at this, okay, so who really is at risk? This is majestic, and it's not peer-reviewed yet, but it's so important. So over the weekend, let's see if I can. So this is something that, so it shows the risk factors for mortality with COVID. So anything that is to the left of that little line there, that's increased risk, and anything that's on this side is protective. So here's something that's super interesting. So smoking, you can see a little bit of increased risk, I think, yeah, right on the line. Being immunocompromised is a little bit more, but obesity by itself is a risk factor. Being male, we've already heard about as a risk factor, but not as much as diabetes or as obesity. Hypertension is itself a little bit more risky than being male. Kidney disease, super bad. I gotta use my glasses for this. Oh, so here we go. So this one is age greater than 65. And if you look, there's also age less than 40, and that's very protective. So they looked at all of these different factors, and they put together a ranking list. And so this ranking list is based on about 100 and something thousand cases in Mexico. But I found this to be really useful to start basing our decisions on. So this was very interesting. So pregnancy and being immunocompromised. No, pregnancy and then having pneumonia were way at the top of super, super risky. That added 7 to your risk factor. Having diabetes added 4. Each of these things individually added 2. And then they've got a little chart here that shows you if you're at high risk, medium risk, low risk. And I think that this is exactly what we're going to need to have for us to be able to realistically figure out who's at risk and what we can do. Now, one idea I had was maybe the 1 in 6 high school seniors who are trying to figure out what they're going to do for their college plans. I mean, 1 in 6, I guess everybody's figuring it out. But 1 in 6 apparently are planning to change what they were going to do before COVID. Whether they do a gap year, whether they can't afford the school that they wanted to go to, whether they don't want to leave home and want to stay close. Lots of different decisions. So for the people that are thinking about doing a gap year, put them all into a trace and track program. So teach them how to do testing, isolating, quarantining, and then when we put all of those things together, in the fall when the cases come back, we'll be ready to actually do a good trace and quarantine plan. But before then, all of those high school young adults who are graduating and going into college, they could be the cadre that goes out to people's houses who are vulnerable. People that are in the red zone here, those are the ones that have volunteer shoppers. Those are the ones that have this young COVID force goes out and brings them food, and does what they need to do, protects them, that sort of thing.
We have a question.
Yes.
It is about sleepaway camp happening this year. Assuming that would be in mid-June, do you think that will happen?
All right. So the question is about sleepaway camp, and I'm going to use that as a segue to go from. Oh, first of all, I do want to tell you though the reason why I think that that having diabetes and having obesity are independent risk factors is probably because it turns out that, particularly for males, if you have increased fat tissue, it causes your ACE2 receptors, which are how the coronavirus goes in, it causes them to become more active and you get more of them. So probably what's happening is because there are more ACE2 receptors everywhere from the nose, like we've talked about, all the way down to the lungs, there are more places for the coronavirus to latch on. So there is a specific reason why it would make sense for that to be an issue, whereas in no other disease that I can think of is that actually something that matters. So getting away now from COVID-ish, let's talk about pain, fear, and focus. So I think that the pain of being at home, knowing which of the risk factors you have, and hopefully some of our patients who don't have many risk factors can feel a little more secure about going out to get their chiropractor's visit, going out to get their knee replaced, unless you're over 65, but at least you can make an informed decision on risk. Second thing is, for fear, So there is a website that we will put up on the site that is meditations for kids. So bedtime.fm/peace out. And so it's a lot of calming exercises, meditation exercises, and freely available online for kids. Now, sleepaway camp over the summer. I actually am going to say, yeah, I think it's okay. Because if you are a healthy child and you are under the age of 40, which I'm going to assume you are, if you don't have, and the diabetes actually that was looked at in this Mexico study was type 2 diabetes, which is developed as an older person, so it's not the same as a younger person. It's not the same as type 1 diabetes that you develop in childhood, usually. So, and if you're not immunocompromised, then your risk is really, really low, and for a very, very low risk group, it's unlikely to spread. So, your mileage may vary, talk to your doctor, but if my kids had sleepaway camp, I would let them go. If they did not have immunocompromise and if they weren't smokers, but it's so protective to be less than 40. So lucky them, not lucky me. But there wasn't any increased risk between 40 and 65. So I got that going for me, which is nice. Now, in terms of focus, there are many things you can do with time inside the house, but one of my favorites is the idea of using the time productively to learn a new language. Many of you may be aware of the app called Duolingo, and it's got a little owl, helps you learn languages, but we have recently discovered one that I adore that is called Memrise, Memrise. And the reason it's really cool for learning a foreign language is that they have you repeat phrases and words, but they give you a little video of someone from that country saying the words. And the fun thing is that a lot of times these people are you can tell they're laughing hysterically because the camera people must have just gone up to them and say, "Excuse me, do you mind saying where is the post office?" and so they're going, "Where's the post office?" But they say it, of course, in Portuguese or whatever language you're learning. But they're all really happy and amused people who are saying nice, or enthusiastic people saying, "I would like 2 beers." So Memrise, good app, learn the language. Finally, we are still very excitedly, we've gotten picked up on Mark Halperin on Outcomes Rocket with Saul Rodriguez, and this is what they're talking about, is the fact that we have put together, for people who are at home and need a pain care package, we have put together 50 different evidence-based items for what works for pain. So this list is now coming for free whenever you get a VibraCool. Our pain care packages, instead of, this is our plantar fasciitis normal. This is our, let's see, so our normal, if we have our elbow unit, in the pain care packages, they're coming in this cool little box, and they open up, so you've got your thing, and then we've still got lots of extra freebies, and our pain care partners have joined with us. So you've got pain creams, you've got coupons, you've got a bunch of neat things. So if you go to buzzyhelps.com, you will see very clearly what works for pain and 50 plus ways to deal with pain, and everything that is purchased on the Buzzy Helps VibraCool website will be 30% off and will come with all the extra goodies for the pain care package. All right, well, I'm excited actually that there is so much research that is getting published. If we can just hold out for another good, some places month, some places a couple weeks, we will be able to really have our hands around who needs to stay home, who is at risk, who isn't, how we can get the economy and everything going back together again. And hopefully we can be very reliable. And when we have more knowledge, we won't have back and forth information like, use ultraviolet light inside your body. But we'll be able to say very definitively, no, ultraviolet C does kill it. It takes a minute, and we're going to put lights that can disinfect in every aircraft and in every hospital room so that we can disinfect between patients. Maybe even little bitty ones of these things that could go inside an Uber so we could disinfect with ultraviolet light between passengers. I don't know. I'm just saying there is so much research happening now. The amount of knowledge we're gaining is asymptotic. It's astronomical. So just hold tight a little bit longer and we will know how to conquer, handle, and dismantle this thing. And until then, it's going to be fine.